the very brief idea that was proposed in the email around developing a national consensus and subsequent strategy for palliative care seemed exactly what needed to happen now in 2016. That the economics of healthcare, the needs of an aging society, the legalization of physician aid in dying up here, all pointed to the fact that this really was a pivotal moment in Canadian healthcare.
In the current circumstances where the federal government has made a political commitment to make some headway in palliative care and home care in particular, I think the value of this kind of conference is that you are bringing all the players together, you are bringing in some evidence about what is happening across the country and elsewhere, what works, what doesn't work. I really was quite impressed by the polling that was done as well in advance of the conference. And I think the novelty and the innovation of this conference, which I haven't experienced before, is the way that the organizers have brought all of those factors together with a group of people who are not really necessarily experts in the issue, but that will be able to sift through everything they've heard and come out with some insights that to offer to the rest of the community. And I think that is a tremendous value to all of us who are trying to move things forward.
In terms of issues that give me hope for the future, I mean, again, I think what you've seen are some powerful voices in the room, some people who have a lot of influence at various levels, really united when it comes to a number of these issues. And we've heard from our colleagues in many different healthcare disciplines, the importance of education and support for physicians, nurses, and other care providers, the importance of family involvement in care, which is something we're very interested at all levels and across the continuum of care. And so I think the fact that we bring these voices together sort of with a common goal and a common vision, and we're all looking forward to seeing what the consensus statement will be, I think is a very powerful thing. And we know when it comes to sort of action at the government level, being able to unite all those voices is sometimes the key to helping government understand what the common issues are.
It was a lovely feeling for me of all being on the same page. So I certainly hope that not only filters through this day, but that as these things I think actually do work, that's part of this fractal that our influence in the world just goes outward in this pattern that we don't really have any control over. But I have great hopes that this conference will be a big fractal, that the influence will permeate our culture and our government and our personal lives. I mean, that's a pretty grand thing, so I can't say I expect to see the results of that anytime soon. But I do think that that's how change works if it's going to last.
My shining hope for coming here to this conference, this exceeded my expectation because we got to talk about systemic issues in our framework. We're very fortunate to live in Canada, but we also have the ability to become leaders. And I really felt that sense today that as the document was being read, I was thinking we really are taking our rightful place as leaders globally to create something brand new that really looks from a lens of holistic care. So my burning desire was exceeded, that we got to put some new language and we got to challenge the discourse and we got to bring a team of people together and remind each other that we're all working together on this. So I am so excited about the potential of where this can go.